Hi, my name is Casey O'Brien. I'm a student occupational therapist at the University of St. Augustine. I see that you were recently diagnosed with postpartum depression, and I was meeting with you today to talk about medication management. Um, the medications prescribed for postpartum depression, there are some precautions and some side effects of those medications. Simply, the precautions are that you should not breastfeed because it is excreted through breast milk. Also, should not be drinking alcohol and operating heavy machinery or driving until you know how it affects you. There are more related to any kind of illnesses or disorders, diseases you may have, so I'm going to provide you with a list of the full precautions. Also, the side effects, there's some common ones and there's also some serious ones, mostly like dry mouth, sore throat, drowsiness, weakness, headache. But if you're having things like a rash or difficulty breathing, fever, increased heart rate, those are things that you need to immediately see a doctor for. Now, I will also provide you with a list of the side effects too, so that you have that for you and whoever you're with to go over. Now, the plan for your medication, I know that you're a new mom, you have a new baby, so your whole life is very different right now. Your routines and everything are very different. So I'm thinking that your medication, if taken once a day, would be great to take in the morning and to incorporate with your morning routine. You can do this simply by keeping your pills in a place that you commonly go to in the morning, which maybe be like you make a pot of coffee, or maybe the first thing you do in the morning is take a shower. So keeping your pills in the area of the thing that you do in the morning not only puts it in a convenient spot for you, but also works as an environmental cue, meaning that when you see that, oh, I need to take my medication. Also, a great way to remind you to take your medication is to download application on your phone. They have multiple different ones. I know you may have some for reminding you about the baby or waking up at night. These applications can have an alarm on your phone, tell you when to take your medication, can tell you when you need to refill your prescription, and you can also set alarms on your phone for a weekly basis, where if you wanted to have a pill box, you could refill that pill box once a week and set an alarm on your phone so that you do that every time and it's ready to go. Also, for keeping track of your dosages, these applications work well, or the pill box in general, because you can see either the empty cubby in the pill box and you know you've taken it, or you can check it off on your application. There are some that will even pay you to take your medication, so you should check out those too. It's also important to remember to not stop taking your medication. Part of being a new mom, you want to be the healthiest mom you can be so that you can take care of your baby, and taking these medications as they're prescribed is very important for that. Also, if you forget a dosage, if it does come down to that, and it's a close enough time to the next time you're supposed to take it, skip the missed one. Don't take a double dose. That is very dangerous and it can cause an overdose. Another point to remember is that, once you get this, becomes a habit, you've been taking it for a couple weeks, you should not discontinue the use of your medication, even when you feel that you're feeling better, because the point of this medication is to not just to get you to feel better, but it's to keep you feeling better. And now I'm going to have this all written down for you. I'm going to have some resources available for you too, of where you can buy different pill boxes, or where to get these applications on your phone. I'll provide it all on a handout. Along with your precautions and side effects. And if you have any questions, feel free to call me or the office and I will be there to answer.